Our passion didn't start with the mouth. It started with people, with the well-being of the profession. And if you're like me, maybe a little bit of your nerdiness and all things tech too. We all want to love what we do, but the truth is, burnout, people problems, and glass ceilings can keep us from doing what we set out to do. So let's get back to the heart of connection. Welcome to the Dental Handoff. This show is about passing you the knowledge, the habits, the systems, and the strategies to lead your teams, lean on your tech, and listen to your gut while you take care of people and truly the overall health of our communities. Let's stop using the wrong end of the toothbrush, y'all. My name is Dr. Kelly Tanner. Oh, and uniquely, I'm a dental hygienist too. You can consider me a guru in the dental and leadership industry. With over 3 decades of experience, my goal is to take you to the next level by empowering growth, perspective, and confidence. By identifying the gaps, recognizing the plaque, and extracting the truth with the other experts in the field. I'll share their stories, empower you to own yours, and elevate your passion in the process. So have a seat in the chair, put on your bib, and let's get to work. Welcome to the Dental Handoff. I am Dr. Kelly Tanner, your hostess, and today I have with me Janice Correa, who I met in Florida at SmileCon. Janice, it's so nice to connect with you.
Oh, yes. Thank you, Kelly. And thank you for this opportunity. I was so excited to meet you. There was so much of a great positive vibe at SmileCon. I loved it.
Yes, it was over near the podcast influencer area. I don't know if you all, the listeners, have ever been there, but they create this awesome, kind of warm, homey, minimalistic, but collaborative environment. Janice, how would you explain it?
I was so invigorated by the energy. People were just having a really great time meeting, connecting, old friends, new friends. I met so many great dental leaders in the industry, including you. And that vibe it stayed with me, the energy, and it just propelled me into wanting to do more in dentistry.
Yeah, it was hard almost to leave the influencer area because they had like the Adirondack chairs where you could like sit and watch the broadcasting on the stage, and it was such a cool vibe. And then I got to meet folks like yourself, and it was just, I don't know, that's what conferences, I think a lot of them are about, is just the ability to say hey and shake a hand or hug a neck and sit down and have coffee and get to know each other.
I agree. Building that community.
Yeah, absolutely. So Janice, when I met Janice, she had such a cool, interesting story and her background. If you see all her credentials, I was like, you have got to be on the podcast. So I always ask Janice, everyone, the same question when they come on is, why dentistry? What did it choose you? Did you choose it? What happened?
I had a great experience as a child. My parents had insurance, so naturally we went every 6 months for our dental checkups, and we had a larger family. The hygienist, I just loved her. She was sweet. She really made me feel so special and unique, just myself. And I know she did that for all her patients. She just loved what she did, and she was very passionate about it. And it's a funny story because my sister told me, and my sister's 2 years older than me, I want to be a dental assistant. I want to be a hygienist, but she never really pursued that passion. And I went it full fold. I'm like, you know what? That's a great idea. And in our high school, we had a tech school. So I took dental assisting there. Okay. And that's how I began. I just fell in love.
So you started off there, and then where from there?
Well, it wasn't enough for me. I am the high achiever, very motivated, and I wanted more education. I did at one time thought I wanted to become a dentist. My life path didn't take me that way, but I jumped into private practice right after, high school. But at that point, I jumped into a VA. Mainly for benefits reasons, but I learned so much high-end dentistry there, worked in the operating room, very young, and I pursued my government career for 14 years, interrupted a little bit with, of course, children, family, a couple of private practice sprinkled in here and there. However, the VA system and the Army system really showed me high-end dentistry. and working and operating, performing orthodontic surgeries and things like that. Opened my doors. And with the government, I don't know if you know this, they give you other opportunities. So if you don't want to do just your main position, they offer other adjunct positions. And that's when I really flourished into becoming the chairperson of the EEO committee in the VA, Army Lean Six Sigma process improvement, patient safety, alongside of my dental assisting. So it just really expanded opportunities for me.
Wow. Okay. I got to unpack that a little bit. I got to back up because how would you, so just starting with the contrasting private practice, because you know what that's like as well. So tell me about the differences with that, with an Army setting and a private practice setting.
I can't tell you that all of the private practice settings I didn't feel comfortable with. There were a few that I did that were higher end. But when you work for the government, of course, you have everything you need. All of the tech, all of the really precautions and training. When you go into the private sector, it's not so much focused on training your staff. You may not have all of the high-end equipment, and especially with sterilization and infection control. I used to teach it in the hospital, and it just wasn't up to my level of expectations. So I was disenchanted. And I did go into, teaching dental assisting. I had a mentor in my life, and she owns a dental school. So I always, at night, believe it or not, worked a full day of whatever I was doing at the time, either dental assisting or office management. And I would teach dental assisting classes, and I tried to really impact those students who, many of them didn't know anything about dentistry. Some of the, techniques that I've learned and how I thought they should really look into it for patient care, patient-centered care. And that's really important. And I think some of these offices or the private practices that I've tempted in anyway, they lose that focus.
Yeah. So I'm hearing you say that some of the protocols were different in terms of, safety precautions, like infection control, were different, and the technology sounds like it was different. What else were some differences there?
I could say that some of the dental assistants, in both sectors, I can't say just government or private. It took me a long time, and that's why I started my own podcast about work ethics, because I found over the years that I was looked at like different, because my drive and my search for knowledge, the motivation for me to learn from others, whether it be a dental assistant, hygienist, dentist, any leader that was willing to teach me, it kept me going forward. And I wanted to always tell people around me, because they would say, what gives you the motivation, Janice? I tell them, when you feel like you're burnt out in your career, or whether you're a dental assistant, hygienist, dentist, anyone, front desk manager, kind of work around your community and try to kind of fit in somehow, like we did with the SmileCon. We're involved with Empowered Dentistry, and find those people that kind of feel right for you, or build your own community. And find what really you want to see in dentistry. If you want to make change or be a part of volunteering, which I did a lot of.
So you were on different committees. You were teaching dental assisting. Now, that was not in a military setting. That was outside of the military, in your friend's dental assisting school. What state was that in? Was it a CDA that you were teaching, or EFTA, or what were you teaching at that time?
It was in New York. It was a fundamentals program, and it was it was endorsed by the dental districts in New York.
Okay.
And she had about 12 schools, and she's still running them. And I was actually her first instructor, and then she just kept growing and growing. But it was quite interesting. I first worked for the tech school, one of the same tech schools that I had my own training. They were not, they kind of geared the dental assistant, the student, up for taking their Danby exam.
Mm-hmm.
It wasn't one of those type of programs that were licensed by ADA or anything like that. But it
Gotcha.
just got the student started fundamentally and got them job. I mean, I placed so many students before they even graduated.
Wow, because it's such a dental assisting, I think, can be kind of overlooked in, well, I know as a dental care provider, I don't ever overlook the dental assistant, but people will just talk about the dentist or the hygienist or front office. But dental assistants are just, man, I always call them the glue of the office. They keep everything going. I would not have been able to do. I don't think any of us would be able to do what we do without a dental assistant.
Oh, thank you for that. I just got I listened to one of your podcasts with Kevin Henry, was it?
Yeah.
He's the one who did the Dental Assisting Nation. Oh my God. Dental assistants should listen to these types of podcasts because some of them, when I worked, especially when I was temping, when I was finishing my graduate studies, they were just lost. They lost their glow, and you can see it when you work with them. And I still, after 40 years, I still have that passion. And I said, you got to find it, figure out a way to do something in your community. I used to, when my children were in daycare, I used to do little demonstrations for Dental Health Month, February. Do things, go on missions, try to find that glow and get it back for yourself and find a better fit for yourself because some of the offices really didn't treat them well.
Yeah.
So I would tell them, maybe you need to find an office that would really, respect you and help you to grow.
Yeah.
And encourage you to take a continuing education and find things that you can focus on, your strengths. Everyone has a strength. Everyone has a weakness.
Mm-hmm.
You got to find that balance in your own self and your career.
So with the podcast that you have, I think you mentioned it discusses work ethic and other concepts. Tell me more about that. Tell our listeners more about that.
Well, it's just to get my feet wet. Basically, I wanted to start a podcast before I graduated with my education degree, and I decided. Actually, someone told me after they interviewed me, and they said, "Janice, your history really shines more in your work ethic and how that started." So I basically begin speaking of the history of my family history. With being raised in the restaurant business and very, very young age when we didn't have child labor laws in our family.
I don't think there are child labor laws in any family. Let's just say that.
But my podcast has nothing to do with dentistry. And I did that for a purpose because I really wanted to dive into the podcast world with something to give people, my listeners, not everyone, those people that could resonate with me as far as the struggle of being a person that, just really works hard and is a highly motivated, high achiever. There's a percentage of people that I didn't know at this time, but I thought I was all alone. Why are people looking at me at the workplace, why are you working so hard type of mentality and telling me, stop working so hard, you're making us look bad. And I mentioned this in the podcast because I didn't know until looking back and reflecting back in my history that, that was painful. And maybe I should talk about it. Maybe there's someone that needs to hear that you're not alone and how to face those challenges and how to overcome that.
So what do you think that's all about, Janice? Like, why do you think that people looked at you like that or said that? Obviously there was a difference in some way because they could see it themselves. It
Right.
wasn't the employer saying it was your coworkers.
Well, the employers, of course, loved it.
Yeah.
But my coworkers felt intimidated and jealous because I would get attention from, supervisors and leaders and wanting me to do more in different directions to utilize my skills. So there was always an imbalance in my workplace, and not everyone, some ladies, especially young ladies, wanted to follow me. and say, what do you do? How do you get onto college? What do you, so I always gave them pointers on what to search for at that time. We didn't use computers so much. I'm dating myself now. But there
Same.
were contacts that I kept. I always had, remember the Rolodex?
Yes, I do. I totally do.
Well, I always had some contacts in the education world and in not only dentistry, just things that I loved to do, whether it became volunteer work. I volunteered a lot in the Army, military warriors, and their families. So I had a following, basically. Some people didn't like me and some people did like me. So I speak to those that find a really uncomfortable feeling when people look at you for your passion and really don't understand you.
Yeah, it can be very foreign to some people. Like why are you like this? It's because they're trying. I think, as you mentioned, they're trying to figure it out, and they're just stumped. Like, why are you doing all this? Why would you do that if you don't have to?
Why do you do that and you're not getting paid extra for it? That was a big one, especially when I was working in the government. They said, they're not going to pay you anymore for that. I don't know why you're trying so hard. It wasn't about me trying to get something. Education, I was getting free education. Everything I did as an adjunct to my position for me was education. It wasn't work. I met people, I networked, I built communities, people that I have for a lifetime in my Rolodex.
Still. But that's such a good point, because you're right, because the more that we lean in, the more we learn. And you could just show up and do 1, 2, 3 and check a box, but is it meaningful, and is it stretching you, and is it making you figure out things that you already have answers to? And so I love the way that you said that, because you're exactly right. When you lean into areas that are uncharted for you, but even Janice, if you knew how to do something, you would, I'm guessing, having met you and listening to you, you would probably push it even more to learn more, right?
I have, when I was at the conference, Rolando Mia,
Yep.
Alro, he told me, and nobody, you know what? Nobody ever said this to me before. How he picked it up and told me, I was really impressed by that. He said, I have a natural curiosity. And when I speak to people, I listen. And listening is a big part of communication I always had to work on. Because let's face it is hard to stop and listen to someone and really ingest what they're saying without already forming your response.
Oh, absolutely.
And I struggle with that a lot. And everybody does. But he told me that my natural curiosity helped me to really listen and ask questions and dive deeper into what someone's doing, whatever it is. It doesn't have to be dentistry. Yep. So that's my personality. That he gave me a different perspective, and it's nice to hear that when someone has a different perspective of you. Like, oh, I am like that. Okay, yeah, that's pretty cool.
What's so funny is right before you said that, I was getting ready to say, it just sounds like you're naturally curious. I swear I was getting ready to say that to you, and then you said that, and it's just funny how everything is connected, right? I was going to say, you learned it because you were curious. You were, I wonder what if, and I would venture to say that that's probably the reason why you're an EFTA, you have your master's, you are where you are now with the company that because you want to learn more, you want to serve differently, you want to serve yourself differently, and you want to serve others differently, right?
Yeah, it's a feeling of, it's not because I need to get paid more. I mean, money, of course, is important. But I feel a feeling of really, how can I put it? Just feel good about myself. I feel rewarded when I can help somebody, even if it's someone, because one of my titles in my career is for me to direct people to career fields. And there's so many people that call me and say, hey, what do you think about this? And because we were taught to kind of direct people based on their skills, knowledge, skills, and abilities to find a career path that would suit them or maybe interest them. So I just naturally want to help people, and I think that's, it just feels good for me. I want to do that without any kind of compensation.
So it's about a feeling that you get when you do it as well.
Mm-hmm.
So what is your master's in?
I build online curriculum. Well, this is what happened. I
was like,
in my career, I wasn't satisfied with, I knew I had to take my bachelor's for becoming a Gov't educator, dental assisting educator. And then at some point before the pandemic, I said, you know what, I want to end my dental career as a remote employee, somehow either building curriculum remotely. I had this vision in my head. And then when I did take my courses, my master's degree courses through SUNY Albany, they had that basic, program that I wanted to build online curriculum, Blackboard and things like that, and wikis. And so the pandemic came and I had that. I graduated. I was done basically. And I'm like, wow, now there's remote jobs everywhere.
Yeah.
So I don't know. It just kind of happened that way. I wanted to make sure I have a large family all over the country, and I wanted to make sure that I had no one to stop me to see my family, which I'm leaving North Carolina on Monday to see and be attending for my newborn grandson.
Yay. So no barriers for Janice at all.
No, I travel. My company knows where I am. I take the laptop. I work. I visit offices. It's just wonderful. It's just a freedom that I dreamed of and I really worked hard for.
And yeah, and now you work with a company that is extremely innovative, and you're making other differences in people's lives, chairside and all throughout. You're creating that ripple effect even more.
Absolutely. I get to visit offices and teach. I absolutely teach the values of point of care saliva screenings and, and how it impacts our oral systemic wellness. And that's really something I never did before. You think after so many years of dentistry, there's really nothing else to learn. I mean, I've been full circle in the operating room and oral surgery with our Army soldiers, jaw surgery, dental assistant, chairside, office manager. But now I'm learning holistic dentistry, biological dentistry, saliva, and it's like another area that I didn't really, plan on, and it's fun.
Yeah, I think so many times one of the reasons why I think people get burnout is because they just show up. I mean, and showing up is a part of it. They show up, they do their job, they go home, and I don't care what job you have. That's boring. I don't know. It's about the connection that you have. I think that, and that's one of the reasons why this podcast exists, because it's about leadership, connection, and technology, because all of those things connect people
Absolutely.
to each other and to other things outside of themselves as well. And so through what you and I were talking about, I know that we have to, maintain. If you guys want to know more about what Janice does, you can look in the show notes, but Janice, I'll let you take that conversation a different way, but I have never seen anything quite like what your company offers. So it's amazing that you are an individual who's representing this and taking this new technology out to say, here's more and here's more information, because with information that we can provide people, they're able to make decisions about their health. And without that, we're running blind. I mean, it's not a one size fits all.
Absolutely. You really have to, I was talking about earlier about patient-centered care. Everyone is different. You really have to take, and that's why I'm just really enjoying learning about spit matters, and because everyone has their own individual ID. And when you are able to examine and test screen saliva, you can really guide the patient towards prevention and in a whole different direction that I've ever learned it in dentistry. So this is a great season for dentistry and dental assistants. If you're burnt out, call me, contact me. I will, help encourage you in any way. I mean, we all go through burnout. We
Yeah,
all do.
we do.
And we might change careers. That's okay too. But you have a unique and special power. Everyone does. You just have to find it.
Yeah. And I hate it when people, like you said, burnout sometimes is inevitable because it's not just about work. It's the illusion of control and balance sometimes that happens when life surges and life happens to you.
Mhm.
And then you have to say, okay, hold on, I'm experiencing this. What can I and how can I handle this? But a lot of it is reaching out to say, hey, Janice, what were you able to do? Or what advice would you offer? And just reaching out for the helping hand to get perspective. But I hate to lose people in the field of dentistry too, because they're so valuable and they came to the profession for a reason. And then I'll usually ask, hey, why were you here in the first place? Like, what did you love about the industry that attracted you? And could we get that back? It's like it's like another kind of relationship, right? Like, why did you fall in love with that person? And
You know,
you know,
it's just amazing. Dentistry is amazing. I have so many wonderful, wonderful stories with my relationships with patients that I will never forget. I mean, luckily for me, I saw full circle, the beginning of their treatment preventative and the end of their treatment. And some specialties can't see that. But yeah, there's something for everyone. It really is. You really have to look, you have to have a different perspective or a different office. A
yeah.
whole different office makes a big difference.
Yeah. Just because you're not happy, don't leave the profession. It may just be
Right.
the environment that you're in. And, I think for a lot of people, the first job out wasn't the love connection.
Correct.
And there's so many different flavors of ice cream out there, and figure out what you love to do. The procedures that are out there are mind blowing. And,
It is.
especially with dental assistants, you guys can go from a specialty, you can go from oral surgery to restorative to ortho to wherever you want.
Exactly.
There's such a wide variety of what you can do.
Yes. And this is a great time because one of the things that I didn't like, and I was disenchanted when I left the government, was because I didn't have the ability to see the patient's record, whole health record. And in the government, you can open up their medical history and see their A1C. They see that they're following up with their primary care, cardiac, or they're having cancer, bone modulating drugs they're taking, things like that. Because quite frankly, they're not going to tell you everything on their health history. And we're still writing them on paper in private practice.
Yep.
But this whole change is taking place now. And I'm reading Dr. Laskin's book, Brian Laskin's book, Dental Disorders. And I'm like, so glad this is happening. And because private practice really needs to get on speed.
Yes. Yes, they do. And I've been talking about this for 20 years. It just needs to catch up because it is such a disservice to our patients and to our community to not be able to treat the entire individual and just seeing this or this. You don't have all the information.
I worked blind. I didn't like the feeling of working blindly. That's what was the most uncomfortable feeling coming from the government, having those medical files wide open for me to look at. And when I worked as a temp in private practice, after I retired and wanted to full circle with my degree, how can you work with patients not knowing the information you need to know? I felt very uncomfortable with that. And not taking, their blood for diabetes or whatever, finding out more. You really had to dig deeper with the patient, find out what they're taking, because a lot of them, quite frankly, forget what they're taking and forget the last time they seen their cardiologist. And that scared me.
Yeah.
That was a huge risk.
And then even Janice too, when we have, even in hygiene, when we do have access, let's just say that you're in a practice, your patient is bringing their health history. You have as much access as you can. Sometimes we're just not putting it together ourselves as practitioners, just to ask the questions. And that to me is the most frustrating. It is not about removing calculus. It's not the last thing that's about, but it is not about that. It's about the whole health of the patient. Are you asking them about about their last doctor's visit? What did the doctor say? Is that normal for them? What's their range of normal?
Patients don't even know why they have dry mouth. And
Yeah.
it's because possibly their hypertension medication. They might have been told, but maybe they've been told so much that they don't remember that part of the conversation from their cardiologist or their primary care physician. These are the things that we as in the dental profession really have to open up to patients to make them realize that this is connected to your whole body.
Yes.
The mouth body connection.
Yes. And it begins with us. It really begins with us. So Janice, this time has passed by so quickly. I have so enjoyed having you on our show today. Is there anything else that you would like to leave our audience with? Did you want to say any, advice that you may have, or whatever you'd like to say?
Well, first of all, thank you for this opportunity. I just really enjoyed seeing you again and speaking with you and speaking to the audience here. I'm not doing clinical dentistry anymore. Quite frankly, because I'm, market manager for a company that sells dental device. And you can find more information on LinkedIn. I am on LinkedIn, and you can find my bio there. I am working on my podcast. I have 3 episodes on it. It's not a video. It's not high end like yours. It's just audio. But you can get a hold of me as on my Gmail. Is it me.thepodcast@gmail.com.
I love that. Well, thank you again, Janice, for all that you're doing. And thanks for leaning in, because it's such a refreshing perspective to hear all the different roles that a person served in and where they really come from and how they show up today. And even 3 years from now, how you show up looking back to say, wow, I did that. And anyway, it's just such a pleasure to have met you and have you on today.
Thank you so much.
And to our listeners, thank you for all that you do for our communities. And don't forget, I always ask you the favor to go on to Apple and give me a 5-star rating, the Dental Handoff 5 stars, please, because Apple is the one that matters. And then go on over to YouTube, subscribe, and share with those you love. Until next time, my friends, be well. Thank you, Janice.
Thank you.